a lot of times with climate change, it can feel discouraging when you know the problem, but you don't know what to do about it. And in this case, I'm excited that we have an opportunity to try to use an alternative cement mix that really gets at this problem.
Yeah. And I think for me, it's almost the opposite in that I was like, wait, you want concrete? You know?
Hi, I'm Jade Benjamin-Chung, and I'm an assistant professor of epidemiology and population health at Stanford University.
I'm Sarah Billington. I'm a professor in civil and environmental engineering and a senior fellow at the Woods Institute for the Environment.
In low-income countries, young children often grow up in homes with soil floors, and they're exposed to a really high level of different kinds of germs, of pathogens in the soil when they play on the floor and when they sometimes ingest soil that's on their hands. So we're trying to understand whether installing concrete floors in homes with soil floors can help reduce disease in young children. We were introduced by our colleague who's also working on this project, and he said, you know, we really need someone with expertise in concrete. And I said, of course, great idea. Who do you know? And he knew you.
Jade came to me with this really interesting project about improving well-being in children and mothers by using concrete floors. And I had not really thought about concrete as being such a positive thing, but was really curious about it and really wanted her to think about the environmental impact of using this material. It's about 6% globally of CO2 emissions is just from cement manufacture alone. And there's already a lot of concrete in the world. I think there's a sort of famous quote that it's the second most consumed material on Earth after water.
Wow.
So there's so much concrete being built everywhere.
So when we met, and you really educated me about how concrete is a problem for climate change, I was honestly shocked, and I hadn't thought about that at all before.
When you were asking about concrete floors, and I really wanted them to be green, I was thinking about all of the different kind of options we have available now for more green concretes. And one of the most common is using fly ash, which is the byproduct of burning coal.
A, I was really happy that I learned from you about that, and B, it was really exciting to hear that there's a potential solution, right? Because I think a lot of times with climate change, it can feel discouraging when you know the problem, but you don't know what to do about it. And in this case, I'm excited that we have an opportunity to try to use an alternative cement mix that really gets at this problem.
Yeah. And I think for me, it's almost the opposite in that I was like, wait, you want concrete? Because I think, so much of the work that I'm doing about like well-being and urbanization is we're trying to like ease up on the feeling of being in a concrete jungle.
Right, yeah.
And so it was kind of nice to see like the positive benefits of concrete, but there are also a lot of negatives. So that's just a really good challenge.
Yeah, and in these settings, actually, concrete floors are one of the most desired sort of home upgrades that in these rural communities people can aspire to. We're just looking at very different ends of the spectrum.
Yeah, your whole field of like, will these pathogens live? It sets up so many new questions. Like we always talk about cracks in concrete, but now I'm like, oh wait, now I have to think about like pathogens living in those cracks and the environments, and there's been some of that in civil engineering in the past. Yeah, it's just a whole set of new, interesting curiosity points, about the material.
These days, we're all really worried about climate change, and actually our collaborators in Bangladesh really want to focus the research there more on that because Bangladesh is really impacted by climate change. It's just really exciting to me to be able to collaborate with folks who have the expertise to allow us to try to use novel materials in the trial. It can be really tricky, especially because I speak epidemiology language.
Right.
I'm not an engineer, and then we're having a conversation with engineers in Bangladesh, right? So that's been one challenge so far, but thankfully we have a multilingual team and people with all kinds of different expertise on the team, and so it just means more conversation, I think.